my first patient for the Platelet Rich Plasma Injection. And what we did today was to try to help her arthritic pain in her knee by injecting her own platelets in her body, by drawing the blood out of her arm, spinning it down into a centrifuge machine, concentrating the platelets, and get the concentrated platelets, injecting that right into her knee at the source of her pain. And hopefully it's going to help the inflammatory response, decrease the inflammation, decrease her pain, also by injecting the growth factors, helping the whole process of her pain.
And this is the first time you guys do it here?
First time we've done it in this area, yes.
Is there any other place that they've done it?
There's no other location in this area that's done this procedure.
What about in the state of Texas?
The state of Texas, probably in Houston and Dallas, I'm pretty certain of that, but it's coming to the smaller to moderate sized cities like we are in this area. So we're very excited to bring this technology here to this area.
Can you tell us a little bit about the procedure itself?
Sure. So basically the patient comes in for an evaluation, and I did her evaluation a few weeks ago to see if they actually would benefit from this procedure. Along with this, I get x-rays, and making sure the x-rays do show some arthritis or any sort of problem that can be fixed or help be fixed with this injection. If that's the case, we interview the patient, talk to them, examine them, and if they're a candidate for the procedure, we bring them back like we brought Ramona back today for the injection. And then from there, the injection's done like I demonstrated earlier today.
Tell us a little bit about Ramona, and I think she's had steroids before and different procedures done.
Yes, Ramona's had chronic knee pain for several years. She's a nurse on the 3 West Rehab unit with me. I'm the medical director of rehab on the 3 West unit at the hospital medical center. And I've noticed for the last year and a half since I've been working there, she's had difficulty walking at times because of her knee pain. I've asked her numerous times how we can help her. She said she's had shots in her knees with steroids, and those have worn off. The first shot works for a few months, I believe 3 or 4 months. The next shot only worked for 2 weeks. So I was telling her this whole time, I'm going to bring a new technology to this area. She was excited once I started, and I said, you're going to be my first patient. So she's my first patient today to put the platelets back into her knee, help the growth factors do their work. The body's going to take care of itself, kind of repair itself. That's what we're doing here today.
I hope that people will look at this and consider this alternative treatment, because I know a lot of people don't have time to take off, or they don't want to go to the surgery. I mean, if this was no anesthesia, it was painless, and I can go to work tomorrow, so I think that's great.